Hey, my name's Darryl Gebien, Dr. Darryl Gebien MD, MSc, and something special happened today with a community consultant group meeting with Sara Clarke from MetaPHI, which is through Women's College Hospital. And I had my first meeting with everybody, and it was wonderful. And something got sparked in me when I heard some people speaking about their experiences. And I wanted to form a Facebook group so we can all kind of unite those who care about others in their communities, who are providing any sort of treatment or help for others who are battling with addictions. That's who was in the group with me today, and to let them know and everybody else know that I'm part of this group too. I'm in long-term recovery from opioid use disorder, which was Percocet and fentanyl. My active addiction was from 2009 to 2014, which ended catastrophically, but fortunately I'm alive to talk about it. I was on Percocet, graduated to fentanyl, went through a lot of criminal issues, dealt with it. I went to jail, prison, 3 rehabs, and here I am talking about it. And believe it or not, I was able to maintain my medical license, even though I abused my prescribing privileges. I paid dearly for that. But now I'm on the upswing, and I really care a lot about what this group has to say and to unite. So unity is the goal, and I will do whatever it takes in my position to help that along, because I care about people who are suffering, especially ones who are actively using independently and in isolation, scared to ask for help, because I was there too. So my heart goes out to them, and my heart also goes out to the ones who are in recovery or those who've gone through drug addiction education programs that want to help others, because this is a passionate thing for all of us, and it takes special people to reach out and to get in there in the trenches and help others who sometimes don't even want to help themselves, and that's okay. The idea is to combat the isolation of addiction, to minimize harm reduction, to get people talking about their problems. Even if they're actively using, it doesn't matter. Total abstinence is one school of thought. It's okay. I don't care which school of thought it is. It's the isolation I care about. And I care about helping unite those who wish to reach out and help others. So that's this group. And I just wanted to thank Sara and my group members today, and everybody else who might be watching this video and joining the new Facebook group, to know that there's some leadership here. It came up, stigma, and that's a big one that I feel passionate about. So I see both sides of the equation here. I was an emergency physician working in busy emergency departments, and basically judging and mistreating patients because they were frequent users of the emergency department, or they declared that they had a history of substance abuse problem. And what did I do? I shot them, or kicked them I should say, while they were already down. And that's what's happening in our healthcare environment. Burnt out, uncaring, hyper-judgemental healthcare professionals that are mistreating those who are actively using. So that has to change. The same thing happens with people who are from minority groups. Indigenous Canadians get treated like shit. And I know what that feels like, because when I was on the other side of it, I presented to emergency departments because of severe intractable back pain. That's what started my whole issue with opioid addiction, and I've had 2 surgeries. But when I identified, or they just knew me from the grapevine about my history of addiction, they treated me very poorly, with judgment, stigma, bias, discrimination, and that is completely unacceptable. We are all equals, and I think I need to impart that very loudly and clearly on the healthcare providers to straighten them out. It is completely unacceptable to be thinking that they know better than another human, another individual. They've forgotten the important part of why they went into healthcare in the first place. So I want to throw that bullshit out the door. I want to fix things. I want to fix our system, and I want to help those who are struggling. Because the last thing we want to do is kicking people when they're already down. I know what that feels like. I've been there. So it seems that there's a vacuum here. We are siloed, all these healthcare providers in their respective communities, and Sara Clarke brought them together today, and that's what the special thing was in this meeting. And I want to glue it all together and grow this baby and make some change. Complaining is too easy. But I've learned in my own recovery that if I'm going to complain, which is okay, it's okay to be critical, but if I'm going to, then try to come up with a solution. Let's invoke some change. And I know I'm not the only one that cares. All of you guys care too. And so we got to cozy on up to each other, form a, for lack of a better word, a union, unity, so we can cause some shit, straighten some bullshit out in society. And I'm lucky enough to be alive and lucky enough to know both sides of the equation to help improve the healthcare system. I want to get in the heads of the healthcare providers who are casting judgment. They're human as well. People make mistakes. Sometimes they just follow by examples of other treatment, their teachers are the ones with the bias and the stigma. So I don't want to cast any villains. Everybody makes their decisions based on their previous life experiences and traumas. And so the way to fix this problem is to understand it first and then get some change happening. All right, so that's enough for this first one. I'm going to make more videos in the future, but I can tell you right now, there's a fire burning in me. It's been 8 years now since I have taken a lot of hits. Just getting myself up, dusting myself off, and that's who I am and where I am right now. And I can't wait to do some good things along with you guys. We're all equal. Love to all.